lab is about CNS. It's lab 1. The slides involved in the exam written in the board, so please take the number of them. We'll start by CNS hemorrhage. So we have different types of hemorrhage according to the size of the hemorrhage. And each side has different cause, okay? So here we have intraventricular hemorrhage. This is quiet. So here we have this ventricle, as you can see. And if you compare this side by this one, here we have, within the ventricle, we have a hemorrhage, okay? So usually seen in premature babies, okay? Here we have another example. We have intracerebral hemorrhage. This one usually caused by hypertension due to rupture of the blood vessel, lead to the hemorrhage within the cerebrum, within the parenchyma. So here, this is the ventricle. It's compressed by hemorrhage of intracerebral hemorrhage, okay? Here we have another example. Here we have a large hemorrhage within the brain, and also it is caused, as I mentioned, by hypertension, lead to intracerebral hemorrhage. Here we have third type of hemorrhage. Here we have epidural hematoma. So this is above the dura, and usually it's caused by injury of middle meningeal artery, usually due to severe trauma, lead to this rupture of the middle meningeal artery and lead to epidural hematoma. So this is, how do you know this is epidural hematoma? Here you can see this is the bone and quite. And here we have the brain parenchyma, and above it we have here what? The dura. So the hemorrhage is above the dura, so it is epidural hematoma. Let's compare it with the other type, subdural hematoma. Here we remove the dura, then we can see the brain, and the hemorrhage is immediately between the dura and between the dura and the brain. So this type we call it, as I mentioned, subdural hematoma, and usually it is due to rupture within the bridging vein. So I'll show you the normal bridging vein. This one. This is the dura, and here we have the brain, and this is the bridging vein. Usually, this leads to subdural hematoma, and usually seen in older patient and within minor trauma. So the patient will not remember usually that he had a history of trauma. Okay. So here we have a little bit older hematoma, which is a little bit organized and like it's clotted. So here also we have bilateral one. So if you see here, we have a dura, and this is just beneath it, it's just reflected. So it is a subdura. So I will not talk in detail about the circle of Willis, but the important causes of another type of hemorrhage, which is called the subarachnoid hemorrhage. So we mentioned intracerebral, we talked about intraventricular, epidural and subdural hematoma. We have a subarachnoid hemorrhage, which is usually also caused by what we call aneurysm, which is abnormal weakness within the blood vessel, lead to like formation of the pouch or sac within the wall. So it can rupture and lead to hemorrhage, subarachnoid hemorrhage. The most common site, as mentioned, between the anterior communicating and anterior cerebral artery, this one in this circulation is the most common site. And here we have a aneurysm formation. So here, this is an example of here. As you can see, this is the aneurysm formation. We call it a perianeurysm. Here seen between the left middle cerebral and anterior communicating artery. This is the anterior communicating, and this is the middle cerebral. Here we have another example of perianeurysm, but here we have a ruptured aneurysm. And as I mentioned, usually why it's ruptured, what it is from more fragile than the normal blood, because we usually the elastic lamina is missed, and the media, which is part of the normal layers of the blood vessel, is missed. So because of that, it's more susceptible to have a tendency to bleed. Okay, here we have an example of ruptured aneurysm, and here we have an example of 3 aneurysm formation here. This one and this one. So here we have a bifurcation of the artery, and here we have let me say thinning of the wall and formation of the sac. It is saccular in appearance. And here, as I mentioned, it leads to formation of subarachnoid hemorrhage, as you can see here, due to rupture of the aneurysm, lead to blood formation, and this is abnormal. So we call it subarachnoid hemorrhage, and it is the most common cause of subarachnoid hemorrhage. Here we have also, as you can see, blood collection here and there, so it is also due to rupture of a aneurysm. Here within the cerebrum, mainly, we can see here a collection of the blood. So we talk about hemorrhage, now we'll talk about infarction. So usually the infarction is caused by thrombus formation or thromboembolism, okay? So, or can be also caused by hypertension. So lead to, due to occlusion of the blood vessel. If it is a chronic hypertension, so we mentioned that hypertension can lead to hemorrhage, and also now we can say it can lead to infarction. In the earlier cases, the hemorrhage was due to, let me say, malignant hypertension, that means high blood pressure, but when the patient have long time chronic hypertension can lead to infarction, and here we call it a lacunar infarction. Lacunar means empty space. So as you can see, if you compare this side with this one, here we have an empty space. We call it a lacunar infarction. Here we have also an example of infarction. Here you can see the color is different from this side, a little bit darker in color, so it is a sign that there is an infarction. The cause here was a thrombosis. So as I mentioned, the hypertension can be complicated by thrombus formation and lead to infarction. So according to the time of infarction, you will see different picture. In early, you will see just a change in coloration. In a mid, you will see a little bit more want to form a cyst. And when it is completely forming a cyst, usually it is late infarction. So here also we have an early or acute early infarction. Here you can see only a little bit of darker color in this side and this one. If you compare it with this normal one, so here it's abnormal, it's a sign of infarction. We call it a watershed infarction. Why? Because this is the area when you have a dual blood supply. When you have a dual blood supply, it's an area which is more susceptible to have this kind of infarction. So it's here an example between the lateral and between here, as you can see, between the anterior and middle cerebral artery. So as I mentioned, there was an early infarction in a little bit a mid. You have here a little bit want to form a cyst or due to formation. If you see it under the microscope, you will see a macrophages, a lot of macrophages. They eat the normal brain parenchyma. So what leads to this kind of infarction is the presence of thrombosis, which is formed within the blood vessel, and we'll see an example of the thrombosis under the microscope. As I mentioned, hypertension, thrombosis, and embolism, thromboembolism. That embolism means that it is dislodged from other side and move to reach the nervous site. Usually the most common site is from the heart. So having a mural thrombosis, dislodged, then it will move to the brain and lead to embolism. Okay, so the embolism lead to infarction, different type of infarction. So this is what you see under the microscope. If you take a section from the blood vessel, this is the wall of the blood vessel, and as you can see, it is completely occluded by formation of a thrombus. So it's a plated plug, then it will have in the early stages it's plated plug, and it will be well-established thrombus by the end. So it's completely occluded the blood vessel. So as we mentioned, the early we see just a discoloration, then we have a little bit of cystic degeneration, and here we have a well-formed cyst formation, which is usually caused, as we mentioned, by the thromboembolism, for example, and we call it in the brain, the type of necrosis that you see in the brain, we call it a liquefactive necrosis. Here we have the gross appearance of thromboembolism, which is lead to hemorrhagic infarction usually. You can see this is a dot-like or spots of a hemorrhagic infarction. So what happens usually when we have an injury to the brain? Usually we'll have a formation, what we call the first cell affected by infarction is the neuron. Neuron, you will see different changes will happen to the neuron. Here we have, let me say, a little bit normal one, but if you compare here, we have a more eosinophilic cytoplasm, so we call it red neuron, because they have more eosinophilic cytoplasm. This is signs of the affection of the neuron because of decrease of the blood supply to this area. The most common affected area is the hippocampus in the brain. Here also you can see we have these red neuron. And within the cerebellum, the Purkinje cells. Here we have these cells. You can see the more eosinophilic and rounded in shape, not pyramidal as usual. We call it a red neuron, and this is the most susceptible area, as I mentioned, within the brain. Also, infarction can lead to formation early of the edema formation. So how do we know it grossly? If you compare this side, this is the normal one, but here we have the affected side by the infarction, which we have an edema here. So we have a shifting of the brain because it increases in size due to edema, quite shifting inside. As you can see, this is the midline, but there is a shifting. And another thing, we have a wide gyri here and narrowed sulcus. So these are signs of edema within the whole area affected. So what we see under the microscope, we have a liquefactive necrosis and cyst formation due to presence of these, what are these? Histiocytes or macrophages. These macrophages usually collected in a subacute to the chronic phase. So we have a collection of macrophages, and as you can see here, we have a necrosis, just the debris. You cannot see the outline of the cells. So here we have it in a low power. This is what we see, a cyst-like formation. Here we can see, if you compare this normal area with this one, here a little bit more paler in color due to the presence of necrosis. If we see it in a higher power, you will see there's no cells outlines, only just a necrotic material. And that's what we see grossly when you have a very late infarction. Here we have a cyst formation. This is a little bit preserved, and here we have this cyst formation due to infarction. Here also we have this cyst formation, and when this side affected, usually the distal tract or neuron will be, because they missed their origin, so they will be hypertrophied, like we see here. If we compare the cerebral peduncle here, this is a little bit normal, but if you compare this with this one, lesser in size, yes, smaller, due to what we call a Wallerian degeneration of the distal nerve. Okay. So here is another more example of cerebral edema. If you see here, we have a shifting in the midline. This is the midline, and there is a shifting. And as I mentioned, there is a widening of the gyri, and there is a narrowing of the sulcus. Here also, it's very obvious if you remember the normal one. Here, this is a very wide gyri, and the sulcus is more narrowed within the cerebral. When we have a cerebral edema, and here also we have the shifting of the line. This is supposed to be the line, but as you can see, the whole cerebrum here is moved to this side due to edema, and here we have a wide gyri, as you can see. Just 2 slides. This is what we call, we talk about infarction and hemorrhage. Here we have a congenital malformation. It's known as Arnold-Chiari malformation. Just brief talk, this is quite due to herniation of the cerebrum within the foramen magnum. So you can see here we have an elongation of this. This is abnormal. Here we have the cerebrum, and here we have elongation. And if you have the skull, you will see it extending below the foramen magnum. And just a slide about this one. Here we have, if you compare with the normal that you know, here we have a thinning of the cortex. Usually this is seen in a vegetative state. What do I mean by this? When the patient having a brain death and only just ventilated through the machines, usually this changes, you will see it in his brain. We call it a pseudo-laminar necrosis. We have a thinning of the cortex, as you can see here. Any question?